Hi, Dr. Del Grosso, SF Chiropractic. I want to talk to you a little bit today about some elbow pain. We get a lot of patients come in complaining of pain in the elbow, or burning in the elbow, or achiness in the elbow, either lateral elbow, medial elbow, either place. If you have pain in the elbow, please come in, see us, let us take a look. It oftentimes can be something that's pretty simple, that's easy to take care of, easy, to manage and stuff. If you have elbow pain, it can typically and most often it can occur just from repetitive motion, from repetitive activity, different things. Somebody that types all the time. You've heard of tennis elbow. Tennis elbow, another name for that's lateral epicondylitis. It's the lateral part of the elbow. And it's called that because in tennis you're always rolling the wrist, rolling the arm, and using another one's called little leaguer's elbow, which is the medial epicondylitis. That one's because when you throw the ball, you do just the opposite. That constant repetitive motion doing that. And these are things, itis means inflammation, so it's an inflammation there of the joint or the attachments there, okay? Something easy to manage, easy to take care of. Sometimes it's as simple as just a little bit of ice, a little bit of rest, and just kind of take it easy with the repetitive motion just to let things settle down, and then maybe a brace when you are doing things to keep it from getting bad again, okay? Speaking of braces, let's talk a little bit about braces. First off, for the elbow, if you're having a lot of pain and everything in the elbow, okay, you can go get a little brace, a little neoprene brace or something, but don't just leave it at that and leave that go. Come and see us, let's see what the problem is, because the truth is, a brace isolates, and maybe sometimes isolates too much. Okay, and we don't want that either. Same thing, I see people, they get in an accident and they get the neck braces, or they get all these different braces. Remember, one of the things we want after an injury is mobility. Okay, we want to maintain mobility. When the muscles get tight, everything gets locked up, restricted, doesn't move. We want to restore mobility, maintain mobility. So sometimes a brace is the worst thing you can do after an accident or after an injury. So the best thing to do is come in, speak to a professional, let them take a look at it. Sometimes we can tape something or do something easier where you can still maintain movement, but isolate a little bit the muscle and the muscle function there to allow things to settle down. Don't just put a brace on something, because remember, inactivity sometimes, immobilizing something sometimes can be just as dangerous as the injury itself, or is putting. So don't just put a brace on. And I mean, you hear people talk about frozen shoulder. You see people walk around their neck like this because they've had braces. Not only that, but remember, when you put certain braces on, especially like a neck brace or something, you're restricting movement and everything. You're not losing those muscles. Muscles tend to get weaker. They tend to atrophy. And we don't want that either. You have to maintain the integrity, the structure of those muscles. You don't want atrophy. That's why in sports now they use air cast and different things so they can maintain movement, maintain some of the muscle function there, so you don't get a lot of atrophy of muscles and everything. Anyway, enough today. If you have elbow pain, knee pain, shoulder pain, any pain, please come speak to us. Go speak to your professional. Talk to them. Don't just put a brace on something, think it's going to go away. Sometimes it's easier just to come in. We can do something really simple, get a little bit of treatment and take care of it without having any future problems and without having long-term problems. Thank you, Dr. Del Grosso.